The affected hospitals, namely Hoima, Arua, Entebbe, Jinja Regional Referral Hospitals and Naguru Referral Hospital, have faced a water crisis which has resulted in the suspension of certain services. Hoima Hospital owes 150 million shillings, Naguru Referral Hospital owes 1.3 billion shillings, and Entebbe Regional Referral Hospital has areas exceeding 488 million shillings. According to the Managing Director of National Water and Sewerage Corporation, Silva Mogisha, after inputs from Prime Minister Robina Nabanjja, the Minister of Health, the Minister of Water and Environment and other stakeholders, they agreed to reconnect the water supply to the hospitals on the understanding that a concrete payment plan will be agreed by 30th June 2023.
We are still in negotiations with the Ministry of Finance, and I really must thank the Executive Director of National Water, because we agreed with him that life must be saved first.
During a one-on-one interview with NTV, Minister of Health Dr. Ruth Jenna Cheng highlighted that health facilities have to bear a heavy patient load, yet the amount of money that is provided for water has hardly increased over the years, yet the population has been increasing.
And in planning, you have to factor in population growth. We need to factor in emergencies, because we can't run away from emergencies. The emergencies may be epidemics, the emergencies may be road traffic accidents or otherwise. All these things need to factor in. So every year there needs to be an increment in the bill of utilities.
While the Minister of Finance previously attributed such incidents to poor planning, Dr. Acheng has asserted that planning becomes easier with adequate resources. The minister further added that there is need to have conversations on how to handle hospitals when it comes to tariffs.
Hospitals cannot have a control over the amount of water utilized by the patients, utilized in the theaters, utilized to ensure that we prevent infection. It is very difficult, and yet the water tariffs are high.
The minister has called for a change in mindset towards making contributions for health services, which would help mobilize resources to address the needs of health facilities.
We can no longer keep hiding our heads in the sand and thinking that health services should be entirely free. People need to contribute for the services that they enjoy. And in that regard, as I mentioned previously, we are working on a national health insurance scheme where people will contribute.
The Ministry of Health acknowledged ongoing discussions with the Ministry of Finance regarding the payment of water areas. Nobat Atkunda, NTV News.